In this segment, I'm going to show you how to properly give sub-Q fluids to a puppy. You want to put on tight-fitting gloves. You're going to need a Sharpie disposable. You're going to need an 18-gauge syringe. So the smaller the gauge is, the thicker and the bigger your needle is going to be. For very small amounts, you can use a small needle, like for example a 25 gauge or even something much smaller. You can also use the butterfly needles that we order at the store. I don't have one now, but you can use those as well. What you want to do is clean the line, so you need to get an alcohol wipe. Get an alcohol swab. You have to clean your whole line. And you want to do this before taking the puppy out of the kennel. Okay, but you clean the whole line. Okay. You make sure that this is closed all the way. It's very important that you always remove the tip, even if you think that it's new, that it's never been used. You need to remove this. Dump it into the Sharpie container. You need to make sure that you break a brand new one. Apply a little bit of pressure to make sure that it's on properly. We do have a protocol binder. Our protocol binder is following on sub-Q protocol. Once we have cleaned the line, you want to determine how much sub-Q fluids you need to give. For a small puppy, you want to give 10 mils, 10 cc's. You can just get a syringe and you can just draw it directly from the bag. What you could do to put it in your pocket. If you can plan a little bit ahead, at least 10 minutes. Draw it on a syringe, put it in your pocket so it can warm up to normal body temperature, and that will be less painful for the puppy once the fluids are going into the puppy's system. For puppies that are medium size, I'm going to say probably about 7 to 10 pounds, you want to do about 20 cc's. For any larger breeds, you want to do, it's about 12 cc's per pound. So you want to do 20 to 25 depending on the level of dehydration, okay? Once again, to see if a puppy is dehydrated, you want to be able to pull the skin from the back of the shoulders and then release it. If it goes right back to normal, that puppy is not dehydrated. But if you pull the skin and it starts slowly, gradually going down, that means that your puppy is dehydrated. The other way that you can check for dehydration is checking the gums. You can lift the lip, put a little bit of pressure on the gum for 3 seconds, then you release. If you see that it goes back to normal, bright in pink, the puppy is not dehydrated. But if it takes a little bit of time to go back to normal pink, or it's just white, then your puppy is dehydrated and you will be able to give some sub-Q fluids. You can always ask a coworker to come and help you restrain a puppy. In this case, we're just doing giving sub-Qs just as a practice, okay? This puppy, as you can see, is not dehydrated, but what you want to do is make sure that you hold your puppy. You want to part the hair. If you need to wet it a little bit to part the hair so you're able to see the skin, you can do that. You want to be able to do as if you were going to give a vaccine. So you want to grab the skin between these two fingers and you want to form a cave with your thumb. Some people hold dogs like this. I usually do it like this. But form a cave like a triangle after you part the hair. Once you have your cave, make sure that when you go into the dog, you don't go straight down, because then you're going to hit the spine and you're going to damage a nerve. What you want to do is go a little bit at an angle, not straight down, but a little bit at an angle. And you have to be careful to not go straight, because what you're going to do is that you're going to pierce one way through the other one. So you're going to pierce through, and when you open the line, all the liquid is going to come out through the other side, or you're going to end up piercing your fingers. So make sure you have clear feeling of your fingers, form the cave high up, and then you go in a little bit at an angle. Once you go in, well, Once you're ready, remove your cap, open the line, and make sure that you release all the bubbles that are in your line. Once all the bubbles have been released, then you're ready. You want to have the eye of the needle facing up. Once again, you position your puppy. Usually when you give sub-Qs, sometimes the puppies are not feeling all that well, and they feel they're very mellow, they're calm. But this one is pretty healthy. So pinch the skin up, form your cave. You can see it right here. Okay, so I make sure that you have the eye of the needle facing up, and you're gonna go in like this. Okay, once you go in like this, don't release, give the fluids. Once you're ready to take it out, hold it, pull out. When you're going to take the needle out, so here's my puppy. I have my needle in, okay? I never let go of the hair like this. I keep it holding even though it's getting filled. I'm feeling with my fingers, making sure that the water, or the fluid, the solution is going inside. You can feel. Before you're ready to take the needle out, make sure that you hold where the needle is. So when you pull out the needle, you pinch for about 30 seconds, okay? You don't want to pinch too hard because it'll be painful, but you want to pinch for about 30 seconds. Once you pull it out, you're ready to close the line. So that's why it's good to have somebody help you. But before you're gonna take it out, and I usually have everything when I'm by myself, I just have everything close to me. So I hold it, pull out, pinch, and right away, close your line. Okay, wait 30 seconds, and make sure that there's no more liquid or fluid squirting out, okay? If it's still squirting out after 30 seconds, you wanna hold it again for another 30 seconds, and then you are done. Make sure that you update your charts with the volume and the amounts that you have given the puppy and your initials.